There's new concern from some Northern Virginians who fear that efforts to slash federal spending could result in cuts to Medicaid. Two families in particular told Congressman Don Beyer in Alexandria that their families rely on the services Medicaid provides, and now they are calling on action from Congress.
Create a barrier.
At a roundtable with healthcare providers and lawmakers, Mary Lee Ruby and Michael Thomas are painting a grim picture of a worst-case scenario.
I don't know what they would do.
Any reduction or elimination of that would be devastating to his care.
Thomas's adult son has intellectual and developmental disabilities, and his Medicaid waiver allows him to live in a group home with 24/7 care.
He can have support from care attendants who are well-trained, who understand that. And he's still within his community.
Mary Lee Ruby's grandson had a brain bleed at birth and now requires complete care. Medicaid covers his daycare.
That's why it's really important that his mother be given the break where he goes to the daycare center during the day, and she gets a chance to do some of the things that she has to do.
Their stories are central to this discussion, and they're just two of many.
If there were cuts to Medicaid, especially at the scale that's being talked about, it would truly devastate the safety net.
Data from the Commonwealth shows nearly 2 million people in Virginia were enrolled in Medicaid last month, including more than 800,000 low-income Virginians.
And it creates literally a chaos in society.
Congressman Don Beyer says he'll fight the proposed cuts and calls on Virginians to share their stories, hoping public opinion can sway his colleagues on the Hill and the White House.
Rather than talking about cutting further, we should be looking at from top down nationally as to how we can provide even more support within the disability community.
Max Marcilla, DC News Now.